The Hemp House is committed to offering safe access to locally sourced products from farmers that we trust. Products that can help you with everyday health and wellness. Our experts can help you pick the perfect product for your needs. The Hemp House, 4 locations to serve you or online at hemphousechat.com.
If you have ever twisted your ankle, then you probably know how painful it can be, one, and how difficult it can actually be to recover from, point number 2. Lucky for us, Dr. Jason Womack is here with Center for Sports Medicine, and whether you happen to be a football player on the field, a great athlete, or just somebody like me who's getting older and has a tendency to slip sometimes at the house, those ankle sprains can happen, and sometimes they're pretty devastating, right?
Correct. Ankle sprains are, upwards of 25% of all athletic injuries. And you don't have to be an athlete to roll your ankle. I think most of us has had an ankle sprain at some point in our life. And the nagginess of an ankle sprain can lead to weakness and giving out and persistent pain that can be debilitating.
I heard years ago, I guess I was slow to learn, but that sometimes a sprain is more devastating for your body than a break.
It can be. Bones typically, and the majority of the time, will heal in about 8 weeks. Sometimes a naggy sprain can go on for months and months and months. And the elasticity of the ligament, particularly if it's a recurrent thing, can take longer to kind of feel normal again.
So what you're talking about today is something called tightrope. It's not new, but it's kind of gained a lot of popularity lately because of professional athletes using it, right? Yeah,
we've been using this technique for quite some time, and this actual procedure is one that, with high ankle sprains, 2 bones, the tibia and the fibula, will separate, particularly depending on the degree of the injury. And the nagginess of this causes instability and pain, and in an athlete, this can take them out of their sport for months and months and months. The beauty of this procedure is we get to stabilize these 2 bones together. We put a bracket on the side of the fibula, and then we put a band across it that is a braided, really strong suture that goes across the joint. This acts like the ligament as the ligament is healing, therefore you can rehab this much quicker than before. So it acts as an internal bracing system as the ligaments are healing around it. On average, in an athlete, we can get them back on the field and the court usually in 4 to 6 weeks, sometimes a little bit longer depending on the size or their position.
This is very interesting to watch, and I'm looking at the spacing between those 2 bones, like where you're putting that suture in, I guess. So does that have to happen? Is there any swelling that has to decrease before you can do that?
Yes, there is some swelling that sometimes it can delay the actual procedure being done. But the majority of the time, we're icing and elevating like crazy. We try to get that surgery done, particularly in the athlete, usually within 7 to 10 days, depending on that swelling. But yeah, the sooner we can get to it, the quicker we can get back to playing. And a week's a long time for an athlete sometimes.
Well, especially for a student athlete. So I bet there are a lot of people who are their parents of football players thinking about those summer practice sessions, and it could ruin a career.
Absolutely. Football's starting to kick back in, spring football, and then you got summer football. And football's not the only sport. That's probably the highest rate that we see these high ankle ligament tears. But I've had a lot of wrestlers actually this year have it, which I haven't seen a ton before over the years, but this year. And then again, it all depends on the rotation. This is a rotational injury that occurs, during your sport.
So, okay, let's talk to the non-medical folks out there. I'll raise my hand because you talk about the high ankle. So if you have just rolled it, like a lot of us have, that's more below the ankle.
Right, so a traditional ankle sprain is going to be the ligaments right on the outside of the ankle, right below the joint line. This is, as the name implies, right above the joint line. And so a traditional ankle sprain where you kind of roll your foot inwards a little bit, say you step on a rock or a crack, that is different than that, but there is that's way more common than the high ankle injuries. The high ankle injuries roughly are in about 10% of the ankle injuries themselves.
Gotcha.
So it's much lower, but it still can be untreated, undiagnosed, and hey, what's going on? This is kind of naggy and swelling for months.
So when you talk about earlier how sprains can be problematic long-term because it leads to weakness, once you've done this procedure, is that weakness gone?
Yes, so for the high ankle part, so yes, so again, you don't get that distraction of that joint, and that joint line is called the syndesmosis. It's a fancy medical term, but it's basically describing where those kind of sit together. The instability comes when this starts to splay out, and studies show even a millimeter of distraction can affect the contact surface of the ankle joint up to 42%. Well, that's a lot because of arthritis and too much play in the ankle. So that stabilizes the joint itself.
Gotcha.
Now, the lower ankle ligament, again, equally as important. That's just more common to have.
So here's where you're going to find him, Dr. Jason Womack at Center for Sports Medicine. Once you've gone through the procedure there, if you're looking for that aggressive rehab, they have all of that in-house too.
Yep.
So it's a one-stop shop. Sportmed.com is the website. 624-2696, the phone number for you to make that call.
Ascension Living provides services and amenities to our residents.
It's such a close